Okay, ladies. Well, I think it would be a really good idea to debrief the case because I don't know about you, but I was pretty scared about that one. Um, how's everyone feeling right now with how things went?
Oh, well, I haven't had a pediatric patient in about 12 months, so wow, I feel very anxious. But looking back, I feel like that went pretty well.
Lauren, how did you?
I felt that it was pretty stressful at the beginning just because, we don't see that many kids here, but, it was nice that we had these resources that we could, really like kind of look at and work through.
I agree.
Yeah.
I agree for sure. Dale, did you have any?
Well, I didn't know when the baby arrived. I just didn't know where to go from there. So it was really helpful when I found out that the baby's heart rate was really a critical heart rate for that age range, looking at the triage poster. And then I was able to follow the algorithm from there, and it just led me straight into resus, which was the correct place to be with this baby.
Yeah, I really I think what helped make the case go as smoothly as it could was the fact that we had the resources and we had a nice kind of poster laid out for us that we could follow. It was easy to read, and we were able to kind of use each of those kind of checkpoints to see where we were. So, I too, I don't see kids all that often, so I don't know if you could tell, but I was really pretty nervous. And I was also nervous just how the baby looked and that we were having problems getting an IV. So I'm glad that we were able to get like an IO. I thought that was really useful. And I also really liked that, I didn't have to think so much about medications because I can never remember which antibiotic is the right one for which age or what kind of pressor is the right one to use.
I agree, and it was nicely laid out for us as well as the doses.
Yeah.
And I found this book really helpful when baby was, once we realized from triage that baby was 10 kilos, we just flipped to the 10 kilos, and everything that you were ordering was really laid out for me. I really liked my pocket cards as well, because when baby came in with that high heart rate, I'm not used to what's normal, what's not normal for a baby of 6 months of age, and it was only until when I pulled out my pediatric heart rate guideline that when you told me baby heart rate was 164, it was in the high range on my pediatric card. So without that, yes, I recognize that baby's heart rate was high, but I wouldn't have been able to know if that was normal for that age or not without my pediatric pocket cards. So I found that very helpful.
I think it's hard when there's, we only had really the three of us to kind of try and do everything that was required. So again, it makes it easier to be able to follow just a guideline so that we can remind ourselves what has to be done, what's been done. And the other thing I really liked was having like a resource that I can turn to when I'm starting to think about having to move this patient, because it was pretty clear to me like baby was not going to be staying in our hospital, that we needed to transfer them. What did you find with the transfer
sheet?
Yeah.
I'm actually really glad. That's my first time using it. That tool helped me identify some things that I would have never thought about for transport. So for example, like preparing blood, the antibiotics that we needed to prepare and start infusing for transport, as well as that transport sheet allowed me to go back and ask mom if baby had any allergies, because that part was missed at the beginning.
Yeah.
So it really cued us in making sure that we gathered all the proper, effective information for transport. I liked it. I thought it was a good tool.
So anything that we can do better next time? I mean, I'm hoping that we have these resources available to us. We're going to keep our poster up in our recess area, and we're going to keep our book and our pocket cards kind of in our recess area so they're easily accessible, so that next time we have our next baby or child, we can easily refer to them.
And I'd like this triage poster at every triage desk that we have.
Yeah,
for
that's
sure.
a good idea.
Yeah.
Yeah.
All right.
Very useful.
It was a good way to recognize sepsis very early.
I know. I think it got the baby into resus quicker. I didn't waste
Yeah.
time. I knew exactly what to do and where
That's
to go
awesome.
instead of wasting time thinking about it.
Great. I'm going to make sure that each nurse has one of these pediatric pocket guide tools as well that we can use in our pockets.
So in terms of how we can just improve our, our next resuscitation case, I think that overall we were pretty good about communicating. I think having tools as well helps with communication, but is there anything that we could kind of work on with our closed loop communication?
One of the things that I sort of lost track with in this case is the amount of fluids that we had given. I was never really sure what bolus we were at. I'm wondering if that's something that we can use as an improvement tool for our next case that we do. So for example, maybe identifying early as a group, our first bolus has infused, now we're on our second. Because at one point, I was a little bit confused. Have we given 3 boluses or 4 boluses?
Yeah, I felt the same way, and I also noticed that with like our antibiotics, because it's we didn't have anyone documenting. We were just the 3 of us, so
That's right.
we didn't have anyone to kind of read back what had been given when, which would have been really useful. So I guess we can improve that next time.
Okay.
We'll find a way to keep track of what's been given in which order. But I think otherwise, we did recap every once in a while just to make sure we were kind of on top of things and that we hadn't hopefully forgotten anything from our algorithm. Did anyone have any further kind of suggestions for communication or?
Well, I thought you did a really good job leading. You were assigning us tasks like as we went, and I really liked how you kind of were recapping, and you did such a good job of kind of sharing what you were thinking. Carolyn and I kind of knew, we knew what you wanted now and what you were going to want in the future. So I thought that really helped.
Thanks.
I felt like we had clear, concise communication throughout the scenario. We knew what everybody was doing at each time. We addressed one another by name. I felt that we were able to close a lot of our loops within that scenario.
So maybe let's all think of one thing we're going to take away from this case and what we'll bring to our next resuscitation. Dale?
Well, I'm certainly going to share the value of having this tool at triage for all of the nurses that do triage. And everybody's anxious when babies arrive, and this was very, very helpful, and it reassured me. And I'll get that word out to the rest of the staff for sure.
That's great.
Yeah. I think definitely kind of reviewing those resources, because that was the first time we had really gotten out this binder, and I thought that it's important for us to kind of look through those meds, because we don't do them all the time.
For me, my take-home message is that to keep track of the amount of boluses that we're giving, and I really liked that we used the push-pull method in this child. I felt that worked very well. So I'm gonna, the next time if I have a case like this, I'm gonna keep track better of the amount of boluses that we're giving.
And I think for me, I'm just going to go back and look at, review the medicines, the antibiotics, the pressors that we would use in this case, because I want to make sure I'm on top of doses. Even though it's nice to have everything laid out nicely for me, I want to make sure that I'm giving the right medicine at the right time for these children. So, great job, guys. Thanks for your help.
Thank you.
Really appreciate it.